Are here with Sean Gjos, who is the founder and CEO of Boreal Wellness Centres, and they are at the forefront of innovation with mental health counseling in British Columbia. Thank you for coming, Sean.
Thanks for having me.
We are reaching out to you because we want to understand a little bit more about Boreal Wellness. Can you give us a top line overview?
Sure. We're a clinic that's based in Yaletown here in Vancouver, and we were created a couple of years ago to fill a gap in the mental health care continuum. And so what we'd observed through some family friends was that for folks that were doing individual therapy but needed something that was a little bit more frequent, a little bit more intensive, but weren't sick enough to end up in a residential or hospital setting, there just weren't a lot of options available for them. And in some cases, people were leaving the country to get what they deemed to be appropriate care. And through some of the work I'd done in the past, I was familiar with group therapy. And so started talking to some psychologists and psychiatrists about the possibility of creating a clinic that specialized in group therapy. And would that be helpful for individuals in these sorts of situations? And got lots of positive feedback. And so a couple of years ago, we kicked it off with running our first group.
During this time, you probably have had to change because you can't see your patients in a normal way. So how have you changed? And also, has there been an increase in calls?
Yeah, so in terms of how we've had to adapt, going back to 2019, we were already working on moving some of our programs into the virtual world. So we had actually had run a pilot program with an insurance company last fall, and that was doing virtual group therapy. So through secure video conference, we had some folks who were struggling with anxiety and depression, and so they got together 3 times a week for several hours and went through a regular group therapy program, and that was very successful, and that had really good outcomes. And so moving into this year, we were looking to expand that when COVID hit. And so when COVID hit, we had 3 in-person groups running, and so we moved those onto our video platform, and that transition went quite well. So right now, all of our group programs and all of our individual appointments are being done through video, and we're just trying to figure out now how we slowly start to get back to doing things in person. In terms of how things switched up in terms of volume, the inquiries have been fairly steady. We haven't seen a big surge there. Where we have seen interest is from organizations that are looking to support their employees or their union members. So we've done quite a few stress management skill sessions for organizations throughout the province, and we've actually done some for some folks in Ontario also. And so these are they're not therapy, but they're a way for folks to get together again through video, share a little bit about what they're feeling, and gain some skills through some work with one of our counselors.
So will you expand? That's great if you can do it across the country. And
yeah, so right now we're actively working on getting a number of our therapists credentialed in Ontario and Alberta. And then once that's done, we'll start marketing our services there also.
Yeah, that's an interesting convergence of virtually connecting through FaceTime, or like we're on Zoom right now, and getting accredited in the said province. So it's kind of neat. I think that could change the landscape of how patients get cared for going forward, don't you think?
I do. I think one of the legacies here of COVID is that telehealth is really going to get pulled forward. Clinicians are going to be more comfortable with it. Patients are going to be more comfortable with it. And so I think that's definitely here to stay. And one of the reasons we were so interested in delivering services virtually, going back to last year, was we saw this need outside of the urban areas. And so if you live in a Vancouver or a Kamloops or some of the larger centers like Victoria, you can generally find access to the services you need. But if you're living outside of those areas, or if for some reason your physical limitations make it challenging, or even if you don't have physical limitation, if you're if you're struggling a little bit with anxiety, the last thing you're going to want to do in many cases is, get in a car or get on public transit where it's going to be crowded and try and get to a clinic. And so offering those people an option to access appropriate care, good evidence-based care, through video conference, we felt like that made a lot of sense, and the feedback we're getting supports that.
Most people pick a career path or a direction based on a passion or in a personal experience. What made you want to choose to start Boreal?
Well, I'd spent the last, before I started, a dozen plus years working in and around healthcare services as an investor, a board member, an executive, and so was really drawn to healthcare in general, healthcare services. But just hearing some of the stories from some family friends about what they were going through with accessing appropriate care here, that definitely struck a chord. And then, as we've moved along here with Boreal Wellness Centres, we've created a nice specialty around working with public safety personnel. So first responders, corrections officers, nurses and physicians. So we've really collected a group of talented clinicians that are familiar with the occupational challenges that come with those roles. And so, a number of our groups have high numbers there, and that sort of work means a lot to me personally. My father was a police officer back in Ontario. My mother was a nurse. So, have some lived experience with some of the challenges and stresses that come with those career choices.
We were mentioning before, but Paige and I decided that during this time we were trying to figure out who would we give back to, and we've decided to give back to the Resiliency Fund for the firefighters, the burn fund, and it helps all first responders. And it's going to be so needed, I think, as this all falls out later on. You tend to think about what people need in the immediate, but I think it's going to be so helpful for the long run.
I agree. It's and there are some studies out there that have come out of the SARS pandemic several years ago, and that research would indicate that the people on the front lines had increased levels of mental health issues post crisis, and so I think we're going to see that again here. And hopefully one of the legacies that comes out of COVID on the positive side is that the stigma around mental health is lessened a little bit. People are hopefully be more willing to talk about if they're struggling, and then to seek out assistance. And for so many people, just the way the benefit plans are set up, their access to good mental health care is somewhat limited. So having a fund like the Burn Fund is set up here to enhance access for first responders and frontline workers is great. And it's wonderful that you guys are supporting it, and Boreal Wellness Centres is also supporting it, which we're very happy to do.
That's great. And what about if you have kids? Boreal is just adults focused.
Historically, it's just been adults. We're working with the 3-story clinic and Dr. Muffy Greenaway and her team to develop a teen skills program. So we know that teenagers today are experiencing a lot of stress and anxiety. It seems much more so than historical generations. And in our clinic, we're often seeing individuals who are in their early 20s or some cases their 30s. Where it's apparent that some of their challenges started when they were teenagers. And so what we're setting out to do there is to create a skills program that will enable teens to hopefully expand their toolkit, have a little bit better understanding about what anxiety or stress is, why are they feeling the way they do, and then be better able to manage it.
That's great.
And then in close, I guess, with respect to the silver lining, you touched on it a moment ago about people realizing the benefits that they've got within their healthcare program. What other silver linings are you anticipating to come out of COVID?
Well, I think for a lot of us, we're spending more time with certain people, in a lot of cases family members, and hopefully some good will come out of that. I think we're also appreciating how much we're social creatures, and so when social distancing is lifted, hopefully we'll get back to being able to fully appreciate those relationships in person. So yeah, those are some of the ones outside of the sort of normal healthcare world.